On August 13th, the Centers for Medicare and Medicaid Services issued a letter to state health officials to help them start to plan for the end of the public health emergency. Now, we're not there yet. The Biden administration has signaled that the National Public Health Emergency Declaration will be in place through the balance of the calendar year, through December 31st, 2021. But states need to start planning now for that transition point. And this letter was designed to help give more predictability to states, to help outline planned policy changes coming from the feds so states can transition their operations accordingly. Now, the feds recognize that states will have a large volume of Medicaid eligibility and enrollment activities they need to do once the emergency ends. They might have pending verifications, redeterminations based on changed circumstances, and renewals for people enrolled in Medicaid. And a lot of these actions have been put on hold because of that continuous eligibility rule that has been in place. For states to get enhanced federal share for Medicaid, they've had to keep some continuous eligibility rules in place. When the public health emergency ends, those continuous eligibility rules ends, which means we've got a lot of activities for states to do to catch up. And states are nervous there's going to be a surge in activity. That guidance coming from the feds gives states more time to process that surge. It extends the timeline for states to 12 months after the public health emergency ends to get caught up on all of the tasks they need to do with their members. Now, there was prior guidance that went out to the states that gave them 6 months to get caught up. The guidance as of August 13th gives them a full year. It updates the timeline and gives states more time. It also made another clarification. It requires states to complete an additional redetermination for those individuals who might have been determined ineligible for Medicaid during the public health emergency, but they weren't terminated because of those continuous eligibility rules we talked about. So let's say somebody's enrolled in Medicaid. During the public health emergency, they went over income for Medicaid, but they weren't terminated. They were held as an active Medicaid member. When the public health emergency ends, this guidance from CMS says that that person has to be redetermined for eligibility for Medicaid before they're automatically terminated. They have to be assessed one more time to see if they will be eligible now. So this guidance to the state gives two types of clarification: timeline and a redetermination process, and more guidance is likely. The Centers for Medicare and Medicaid Services said they're going to continue to help states prioritize actions and outline ways to reestablish a renewal workload that is sustainable. In a quote from that letter that went out to states, the Centers for Medicare and Medicaid Services says, CMS remains committed to providing states and territories with the resources and ongoing technical assistance necessary to respond effectively to the COVID outbreak and restore state operations upon the eventual conclusion of the current public health emergency. In the description below, you can read that letter that went out to states. As we get more guidance from CMS in the weeks or maybe months ahead, we're going to share it with you here.